we might as well maybe start then, I guess. So thanks for sticking around for this. I'm from the University of Leicester, and I'm going to give you a brief overview of some of the research that we've been undertaking with some particular drugs that are derived from the diet. I'm in a chemoprevention group in cancer studies, and I'm actually funded by Cancer Research UK on part of an experimental cancer medicine centre programme. And this basically involves trying to get new drugs into patients as soon as possible at early stages of development. So what actually is chemoprevention? Well, it's the use of a drug. It can be a natural drug, so it's found in the diet, or a synthetic drug, so it's made in the lab, in order to help to reverse the onset, suppress the development of, or prevent the progression of a disease. Because obviously, in terms of the human cost and the cost of the NHS, prevention is better than cure, and the sooner we can stop the disease, then the better. So I guess there's a lot of you thinking, well, can we actually stop cancer from forming? Now, a lot of people here will have a genetic predisposition to cancer. So, for example, with FAP, there's a mutation in the APC gene. But then that mutation, so we'll start off with this. These are cells in the colon, for example. So you can have a mutation here, but actually, to form a cancer, it needs to undergo a series of further changes. So at each step, there's a possibility that we can actually stop these changes, or we can slow the changes down, so that actually we can stop the journey of this initial cell that has a mutation in it from actually becoming a cancer. And that kind of brings us to the research that we're doing in Leicester, and that we're particularly interested in chemicals which are derived from the diet. And we've looked at several chemicals. There's curcumin from the spice turmeric, there's resveratrol from red grapes, there's tricin, which is found in the sort of bran husk in brown rice, and there's indole 3-carbinol, which is found in broccoli and Brussels sprouts and all those things that people don't generally like too much. And why are we interested in food-derived chemicals? Why are we looking at these? Well, because people have been taking them so long in their diet, we actually know that they're pretty safe. They have very few side effects. So actually, if people can take these kind of drugs to stop the cancer from progressing, or to stop the changes that cells then become cancerous, then we can do this at low cost, because they're found in a diet, and also with very few side effects. And when you're looking at prevention, you want to give a drug that actually you're going to be taking for a long, long time, so it's got to have few side effects, otherwise no one's going to take it for the next 10 years. So, just very briefly, what are these strange pictures? Well, some of the work we're doing, we're actually taking some of the polyps from patients who have polypectomy from endoscopy, and then we grow them outside of the body in the lab, and we can look at certain proteins that are involved in changes to make the cells become more cancerous, and then we can treat them with our chemicals and see if that change is prevented. And so this kind of brings us to curcumin. We've done a lot of work on curcumin. So it's the yellow component of the spice turmeric, which is found in typical Asian cooking. It's also actually has an E number. It's E100, and it's found in, if you eat yellow food, it's generally found in there. Margarine, wotsits, all of these kind of things, which aren't necessarily the most helpful for you. It's in the lab, we've seen lots of different properties with it. We know it's an anti-inflammatory. In the lab, it's also an anti-tumour agent. And there's been a lot of studies done in the clinic on it. So there's studies which we look at. We give the drug, where does it get to in the body, how much of it do you need to take, is it practical to take that much? If someone says, oh, it's only going to have an effect if you take 0.5 kilogram of it, well actually that's not terribly helpful. So, we need to know these things before we can actually say, it might be good to take for a drug over a long period of time, because if it's not practical to take, who's going to want to do it for a long period of time? It's also got to be, as I said, they've got to be very safe. Now, some poor, unfortunate people have been in clinical studies, and they're all healthy volunteers for this, and they've actually taken 16 grams of this a day, of curcumin a day to see if it has any side effects, and that's quite a lot. So it's safe up to very, very high doses. And some of the studies, they've been used in inflammatory bowel disease for curcumin, polyposis, in cancer for prevention of maybe secondary disease or recurrence. And also we're looking at it in combination with chemotherapy as well to see if it can enhance how chemotherapy works. Complicated slide, it's just to say in the lab, basically curcumin has been shown to stop cancer cells from growing. It's been shown to increase cancer cell death. It's been shown to actually decrease the blood supply to tumours. So cancers need their own food, they need their own nutrients, they need their own oxygen supply, and they do this by signalling to form new blood vessels. So the tumours are really richly supplied in blood, and that's how they keep growing. So if you can stop these blood vessels forming, then the cancer won't get the nutrients that it needs to carry on growing. And it's also been shown that it can help to stop the spread of the cancer cells. So if you have a cancer in one place as a primary disease, quite often what might happen if it's not fully removed, you might get spread of these cells to other parts of the body, and then that's when the problems really start to occur. So if it can prevent that, then that will also be a good thing. And you might be asking, well, chemoprevention, can it really work? You know, there's not a lot of evidence for it out there, or is there? Well, actually, there's lots of evidence for chemoprevention working already for different diseases, such as pregnant women will take folic acid. That stops neural tube disease in the developing fetus. Fluoride in your toothpaste helps stop dental decay. That's a form of chemoprevention. All of the work done in heart disease to try and prevent heart disease, they include use of aspirin, statins. That's a really effective model actually for chemoprevention in heart disease. We know it works. You know, you decrease your cholesterol, you decrease the risk of heart disease. And more, there are obviously chemicals, synthetic chemicals that are being used to reduce cancer risk. These include tamoxifen, which Julia's talking about in breast cancer, and also aspirin in some forms of hereditary polyposis as well. In Leicester, there's been quite a lot of studies looking particularly in the Asian population for cancer risk because of the association with diet and how diet can affect your cancer risk. And it actually shows that in the older South Asian population, they have a very low risk and rate of bowel cancer. But as the younger population is becoming more attuned to Western diets, with high fat, high sugar intakes, etc., and less use of traditional cooking and foodstuffs, the younger age groups have increasing risk that actually makes them approach the rest of the risk factors for the UK. So, do we give curcumin to people? What's the evidence for it? Well, there's actually been a whole load of small clinical trials that give curcumin to people with various types of disease. But they don't all report side effects, and so, like I said, one of the things we're really interested in is if people are going to take this drug for a long period of time, we really need to know that it's not going to make people feel awful for that whole period of time. And there's been 19 trials that have involved 391 patients that have actually reported side effects, and we've kind of collated all this data so that we know that we have a good profile for the use of curcumin. And the side effects, they're generally pretty mild actually. They're all kind of bowel related. They might include a bit of nausea, diarrhoea, wind is a problem, and it's kind of bloating as well. And the side effects seem to be more prominent for those who actually take the curcumin on an empty stomach. And we've actually had 2 studies recently in Leicester. One of them we've given to patients, we've given 5 tablets a day to patients who are about to undergo surgery for bowel cancer or who are having a polypectomy, so with their endoscopy they're having a polyp removed. And we give it to them for a couple of weeks, and then we take a bit of the tissue. We can measure the levels of the curcumin in the tissue because we need to know actually that it's getting to the place where it's going to work, because there's no point in giving a drug to someone and then thinking, oh, it doesn't actually get to the bowel at all. So we know that it gets to the bowel, we know that it gets there in quite high concentrations, we actually know now that it hangs around for a long time as well. It actually sticks to the bowel. It's quite hard to get off, actually. And we also, with this, we kind of ask the patient's points of view as well. You know, what's it like taking it every day? Is it acceptable? Would you take it for a long period of time? Again, all things that we need to know if it's going to be successfully given over a long period of time. And then we've also doing a clinical trial with curcumin with chemotherapy. And this is a HOPE against cancer sponsored study, and HOPE are actually here with the posters a bit later. And this is giving curcumin with standard care chemotherapy in patients whose bowel cancer has actually spread to the liver already. And actually they're doing really well. They're finding it quite easy to take. Obviously side effects of chemotherapy include vomiting and diarrhoea, which may be made slightly worse by the curcumin, but people are happy to take it. They take 4 tablets a day over the period of 6 months whilst they're having a chemotherapy. So that's going quite well at the moment. So the important thing is how do we take curcumin forward for polyp prevention, particularly in FAP patients? And that's the burning question. And so I'm going to leave you with Joey here. Joey's an oncologist and she's also a clinical lecturer, and she's got a lot of really exciting ideas which actually she really wants to engage with people about and ask for people's opinion. So I'm going to leave you in her capable hands.
So hi, I'm Dr. Joey Wood. As Lynn said, I'm an oncologist by trade, and sort of found research a bit later on in my career. So the way my job plan works at the moment is I do 6 months in the hospital, predominantly using chemotherapy, and then I have 6 months doing research, and I keep alternating. So Lynn has kind of filled us where we're up to with curcumin at the moment, and I want to tell you all about some plans that we've got for the future that I think are really exciting, and I hope you might think are exciting too. We'll see. So as Lynn said, we already have data that curcumin can delay polyp formation in people with FAP. We know that if people who've had surgery for FAP in the past take this as adults, then it can reduce the size and the number of polyps in them. What we don't really know, or haven't really proven, is that this reducing the size and number of polyps actually goes on to prevent or delay cancer in the future. We suspect this may be the case. What I'm interested in doing is looking at patients with FAP before they've actually had the surgery to remove the colon. So at the moment we know that patients with FAP have a very high chance of developing cancer of the colon, and presently really the main way of preventing this is with surgery. And what we'd like to know is there a drug that we could give that would be safe and tolerable for young people that could prevent or delay this surgery? So only 2 drugs so far have been shown to reduce the polyp burden in children, but their long-term use isn't really acceptable due to toxicities. So these are the only 3 studies really that have been conducted in young patients with FAP. The first one was an anti-inflammatory drug that patients took for about 4 years. It was a relatively small trial and had no effect anyway. The second study, showing celecoxib, again was a small trial. It did reduce the number of polyps, but only over a 3-month period, so it's not really clinically practical. And also this drug in adults now, we don't really prescribe it because we know it has risks of cardiac toxicities, so we're getting wary of it. The biggest and best of these studies is aspirin and using a dietary starch, which didn't show any reduction in polyp count, but did show there was a decrease in polyp size if you continue this treatment for over a year. Again, this didn't really look at more relevant endpoints to people with FAP. Did it prevent cancer? Could it delay surgery? So delaying polyp size isn't really going to affect the lifestyle for anybody. So I don't think that trial has really answered the right questions. And also there's issues regarding the safety of aspirin in young patients. We know it can cause indigestion, ulcers, so it isn't necessarily the best toxicity-free drug. So what's my overall aim? Well, the aim really we want to do in the department is to conduct a large study to assess whether curcumin treatment delays or indeed prevents the need for surgery and cancer in young patients with FAP. Now there's many challenges when it comes to designing a clinical study. So before you can set up a clinical study, the biggest thing you need is money to fund the study, which usually comes from some charity, and whether say Cancer Research UK would be one of the biggest ones. And to get this money is incredibly competitive, and you need to really have evidence that your trial is going to be successful before you're going to be able to get money to run it. So problems I could come up with is sufficient patient recruitment. Will enough people agree to take part in this study? If people will agree, will they actually comply? Will they take the treatment daily? Will they be followed up for enough years so I can get the answers I need? I need to make sure the trial's designed to give statistically sound results, so I need experts to tell me how many patients I need, how many possible treatment doses we'd need to use. I need to make sure that the studies answer the right questions that are relevant for patients who I'm going to want to take part, and to specialists treating the condition, so they're actually going to recruit patients. And also, because I want to really give this drug to children, it needs to be acceptable to both the children and to their parents alike. So there's many studies many possible challenges before we can actually go ahead with this study. So really my initial plan is to conduct questionnaires, and I've designed 2 questionnaire studies. One is of patients and their families that are affected by FAP, so either someone with FAP themselves or a healthy parent with a child with FAP. And I've also designed another one for specialists who treat this disease. And really I want to use this data gathered to optimise the study design. So really here it's a bit small, but this is a table I've put together, just sort of giving examples of how the patient questionnaire I would hope would improve study design. So one big issue for me will be recruitment. Can I get enough people on board to do this? So I'd want to know, would patients be happy to take part in this study? And if I have enough people saying yes, I could go to potential funders and say, I have this many patients that'd be really keen to go ahead with this trial, please could you help fund it for us? Another question I have is how young would be able to start the treatment. I don't know what age really patients would feel that children would want to take tablets, be able to take tablets, that parents would be happy for their affected children to start taking tablets. So that would really again guide the trial design and how young we could start. Another issue is many trials we give an active treatment and we give a placebo, so just an inactive drug. And I'm not sure whether patients would want to go on the study if they got the inactive drug. So if that was the case, then I'd have to think of maybe a high dose and low dose study. Endpoints again. So the big question I want to ask is, could give curcumin delay the need for surgery? What I'd like to know is, for somebody living with FAP, how much of a delay in need for surgery would be beneficial? Would a few years be beneficial so I could go through university without it? Would a few more years be beneficial? I could get married and not have the surgery? Could it delay it even more and I could have children and not have the surgery? What would be relevant? This would help me gauge again how many numbers, how long I'd need to follow up the study for, to know what was important for an FAP patient. And again, just which of the other complications known to arise in FAP are of greatest concern, just so I know I'm looking at the right questions for the patients that this is designed to help. Follow-up, again, so FAP is usually followed up by endoscopies. What frequency would be acceptable? Would patients be prepared for their children to have an endoscopy if they didn't need it for clinical reasons, only for study? Or would the study have to be designed so it had to fit in with clinical timings only? Would patients rather come to the clinic to discuss the research and see a doctor face-to-face, or would a telephone consultation be more helpful? How frequently, how often would you be able to fill in a symptom diary? Confounders, so these are things that I suppose could mess up my study results. So do you take any other agents to try and prevent polyp formation? And if you're taking these agents, would you be prepared to stop them to go on a study and take curcumin? Again, this would all just provide evidence to funders that this trial would be scientifically viable or not. And then treatment, again, what dose would be practical? How many capsules would you be prepared to take a day? How long would you be prepared to stay on study medication for? So that's kind of examples of the information you want to find out in order to get this study undergoing. So really my main conclusions are there's so much preclinical data from the lab and early clinical data, predominantly in adults, that curcumin may benefit young people with FAP. And I think, as Lynne alluded to, the most important thing is we know that people have been taking this in their diet for centuries, so it's safe. We need a clinical trial to investigate this further. There's currently, for the vast majority, no proven alternative to surgery. There's many challenges in setting up a clinical study, And I think actually patients with FAP are going to be vital in overcoming those challenges, and opinions are essential. So if anybody here will be affected and will get the questionnaire sent to them in due course, I would be very grateful for it to be completed. Thank you. So I don't know if anyone has any questions for either of us that we've bombarded you with.
Yeah. Having surgery done already, and I have a regular yearly endoscopy. I have biopsies taken because there is some growth of the duodenum area and the stomach area. Would that not be a view that you'd be taking to not just for young patients that are likely to develop FAP, but patients that have developed, they had the surgery, but still have the development of polyps or edemas, as I have, in this actual trial?
So the reason I'm looking at young people and children is because nobody's ever done it, so it's novel. The situation that you're saying to sort of after surgery, there are lots of data sort of showing that yes, we think it does decrease the number and size of polyps, and there's 2 big studies already underway at the moment, one in South America and one in the States, which is still sort of going on to prove it, because I think patients that take curcumin sort of buy it from health food shops. It's absolutely extortionate at the moment, so we don't have that robust scientific data to prove that that's what we should be doing. However, if I was to apply to do that for a study, nobody would fund me because it's already been done in different parts of the world, and I guess we're just waiting for that data to come out over the next few years. Yeah.
What about cancer funds? How much curcumin would you have to take as a preventative? And have any studies been done as a preventative to stop disease coming back?
That's actually a very good question, and it's one of the things that it's kind of an eternal question. How much is enough? And that's actually something we're trying to investigate now. There haven't been any studies which directly address that question, but that is one of our plans that we're actually planning a study to look at those kind of questions. How much is enough? Now, traditionally in the past, you'll see a lot of clinical trials with these drugs because they're safe. The thought is, let's just shove as much as we can possibly get into a patient. And actually, that's not necessarily the best way of going about things at all. In some of our lab studies, we actually, and this is purely in the lab, we can't say what's happening in patients, we actually find the lower doses are more effective at preventing the cancer cells from proliferating. And actually the evidence, the epidemiological evidence, so that's the evidence gathered from all around the world as to the effectiveness of these drugs, it's based on diet. So it's not on a huge dose from tablets, it's actually what's in the diet naturally. So again, that would look towards maybe that you don't need huge doses to have a potential preventive effect. But that's something we're kind of looking into at the moment, so I couldn't give you a definitive answer on that, I'm afraid.
Yeah.
And I suppose I came to this talk today from a different perspective. Myself and my family have TP53 variation, so I felt that, I'm assuming with the cancer risk overall, that the turmeric, is it curcumin, would be relevant. But I suppose what we're generally finding a bit frustrating is that myself and certainly for children is that obviously there's a lot of publication about aspirin and obviously I don't want to stop self-medicating, but in the absence, there just seems a definite absence of, there's a lot of, it looks really good, and I suppose for families in our position, we just want to sort of take it in some form, but safely.
I think the thing is, especially for children under the age of 16, aspirin is, again, not with just the potential for stomach bleeds and ulcers, but there's some actually really serious complications that can occur in children giving aspirin, sort of like life-threatening complications actually. So unless you have very specific advice from a consultant to give aspirin to under 16s, then I would avoid that. Again, like you say, curcumin, what's been proven, again, it's not been proven by clinical trials, so you're in a bit of a difficult situation. It's safe from all the evidence that we've gathered. It's a safe drug. However, the formulation you buy, so there's so many different formulations out there, and so you need to be sure that you're actually getting a formulation that is of a standard that you could actually use as a drug. And I know John's gathered a lot of data on that, but we also have data on where we buy our curcumin from for our clinical trials. So if that's something you want to talk about later, so that you can be sure of the quality of the standard of what we're buying, then we can have a chat. I'll be on the stalls all afternoon anyway, so you can
That would
have
be
a chat.
helpful. And is there anybody that you know who's here today who could talk to you about aspirin as well? And could you take aspirin and the turmeric, or is it one or the other because they're both anti-inflammatory?
Again, I think you have to bear in mind that a dual study of taking both hasn't been done, as far as I'm aware. What you have to bear in mind is that both of them potentially have bowel complications. So if you're sensitive to aspirin and you take curcumin as well, then that may give you added bowel complications. But if you're not sensitive to aspirin and you take curcumin, then again, it hasn't been looked at, but you have to look at the potential side effects. Maybe a little bit of diarrhea with curcumin if you take it on an empty stomach. And obviously you shouldn't take aspirin on an empty stomach anyway because of what it could do to your stomach lining. So we can maybe have a chat about it a bit later if you're around.
I think what you're asking though does illustrate the point that we do need well-conducted, decent studies that give some more information. And even though the study I'm talking about wouldn't necessarily be relevant to your mutation, we kind of feel that FAP is one of the more common genetic conditions, but actually it would sort of be a benchmark for other studies, and if it did work, it would be really exciting for chemoprevention as a whole. So although this study has been set up to benefit FAP patients, we do think that overall it would be influencing more than just that.
I think theoretically it should. I assumed it would actually. Is it possible it wouldn't then?
Well, I think the thing is with curcumin, one of the big things is that it doesn't get into the bloodstream in very high levels. Now we're actually looking at it in cancer that spread to the liver. So we've actually looked in the liver. We do get curcumin in there, but it's not as high in the bowel. There are new formulations of curcumin out there, which mean that you get much higher blood levels, so it gets distributed all around the body better. We haven't done any clinical studies with those, but they have been looked at I think there's been some clinical studies in Brazil, in America, places like that. So the type of curcumin we use is specific for the bowel because it doesn't get into the blood very much, it kind of sticks to the bowel, and so that potentially is better for bowel cancer, but we know that it does get into the bloodstream, and we know that there's other types of curcumin capsules that are available that you get more curcumin in the bloodstream, so they would potentially be more beneficial than just the normal curcumin that you get in the type that we get in turmeric. So again, we can have a chat about that later if you like. Yeah.
What part of the digestive system is it that sort of absorbs the curcumin most? So like in a patient with an ileostomy, is it still going to be a benefit to them if it's...
Well, part of it is actually that curcumin is very poorly absorbed. So actually, but that doesn't really matter if you're wanting it to get to the bowel because it's passing through the bowel anyway.
Yeah,
but
so
as with most things, most of the absorption is the small intestine.
So is it going to help like with polyps in the duodenum and things like that? If it's because obviously if the patient hasn't got a large bowel, is it just going to pass straight through?
So there are again small series of people looking at pouches after surgery, knowing that it can reduce the number of polyps that form in the pouches. I don't think anybody's looked at the duodenum as such, but that would be one thing with the study and talk about, depending how long people would want to be followed up for, because the duodenal ones tend to occur later than the colon ones, as to whether it would prevent that as well.
You have to be inspected every year or 2 years for the duodenum, so forever.
But it seems sensible if it was a possibility, and I can share what you're saying as well, because I've got no answer. Because the fact is, if it turns to slow things down, and it, you know, people that I go and other people go each year, that'd be an ideal opportunity to look at it if it works in that direction as well.
Mm.
Well, I know John with FAP genes has a lot of interesting patients that attend the yearly meetings. And there's one guy there, and I'm sure John will talk to you in more detail about it later if you catch him, but there's a guy there whose children, his 3 children, have been taking curcumin for quite a few years now. And they've looked at, it's kind of a personal trial, if you like, for himself. And they've looked at how curcumin slows down polyp formation and decreases size and number of those polyps in his 3 children that have been followed up over a number of years. And his big thing was delaying surgery until they're old enough to make the decision and to understand actually the consequences of having that surgery. So the surgery's been delayed. I believe one of his children, is he 17 now, John, 18?
18 or 19.
And initially he was told he was going to have surgery at the age of 14, and his dad didn't want that because he didn't think that he could actually cope with that or would understand it. And so they've actually delayed that surgery up until 18 now, and if he does have to have surgery in the near future, then he's happy with it. He understands, you know, all the consequences. He understands what he's got to go through. And I think that's the biggest thing with younger people, is that are they ready physically and emotionally to have that surgery at such a young age? If you can delay it, you know, even for 2 or 3 years until they reach an age where they can, you know, they can cope with it far better, then that's, you know, it's got to be a good way forward.